I move uneasily between the obligation to intervene and the troubling knowledge that much of the work we do, praised as humanitarian or charitable, does not always lead us closer to our goal. That goal is nothing less than the refashioning of our world into one in which no one starves, drinks impure water, lives in fear of the powerful and violent, or dies ill and unattended.
Paul Farmer really has dedicated his life to improving the lives of others, and particularly those who are forgotten, the poor, and the poor who are sick.
In my junior year, I took a course called medical anthropology, and one of the things that we had to do for the class was to go out in the field and do a project. I literally went into fields and interviewed some migrant farm workers, many of whom in North Carolina were from Haiti. If I were to say, well, this is when I got on the track I was now, that's when Haiti came along and medical anthropology, and those are things that I've stuck with all these years.
Paul Farmer is co-founder of Partners in Health, which is an international organization dedicated to improving the lives of the poor. And the model they use is a community health model, which is focused on utilizing local expertise and local knowledge of community needs.
And I think that is an extremely important component of providing care abroad, so that once you leave and once Dr. Paul Farmer leaves, there's work that is continuing to be done on a grassroots and local level.
But for me, the practice of medicine does start with being open to someone else's suffering. And that either is a Pandora's box or the most marvelous experience in the world. And for me, it's more the latter. I understand that opening yourself up to another's pain and chaos is difficult, but it opens all of these doors to really intimacy with people and their families.
Dr. Cornel West is a speaker and a teacher I really admire, and he said that empathy isn't a matter of trying to imagine what others are going through, but instead having the will to muster up enough courage to do something about it. And that empathy then is predicated upon hope. And I think that's really beautiful in so much of what Dr. Farmer does.
In addition to teaching community health workers, Paul Farmer is really dedicated to the creation of a global health workforce. And he teaches to do that. He teaches at Harvard and is chair of Harvard Medical School's Department of Global Health and Social Medicine.
Two words that resonated within me actually come from one of his books, Pathologies of Power. He uses the phrase stupid death. And so stupid death, as he explains it, is a death that shouldn't have occurred. And it probably occurred because of some kind of structural inequality and societal injustice.
Dr. Farmer is a great example that the poor deserve our best. You know, the best educated people who their whole lives have just been drawn to solving inequality.
And at Stritch, we have students who come into medical school, and specifically our medical school, to serve those same people. They are called with the same call for social justice.
This Jesuit idea of living for others, it strikes me as a really important notion, and that's why I'm proud to be associated with that motto. And Ignatius of Loyola.
But also I think we have to go forward with the spirit. How can we help?
When Paul Farmer came in 2010, I was struck by two of his messages. One of them being the power of accompaniment, accompanying patients and the poor on their journey, that no matter what we may or may not be able to do, being there and accompanying them is the most important. And his second message was a message of hope, not to be locked in or feel jailed by what cannot be done, but to remember what is possible in making global change.